Ladies and gentlemen, welcome to this week's episode of What the Hell Just Happened, where we talk about all things healthcare, the good, the bad, the ups, the downs, the lefts, the rights, and everything in between. We also bring on a variety of business owners, business leaders, community advocates, nonprofits, etc., especially here in Northeast Florida. Today, it's a combination of all of that stuff, right? So we're going to talk a lot about healthcare. We've got a business leader here, community advocate, tied into nonprofits. One of the first guests on this show. So if you want to hear some personal stuff about him, you can listen to episode, 6 or 7. I'll look back on
thousands of episodes ago.
Thousands of episodes ago. Millions of streams ago. Wink, wink, wink. There is cameras here. But Dr. Matthew Thompson, now CEO of Telescope Health. My favorite things, husband, father. I'm going to call you a friend.
I'm not your husband.
Well, already, dude. Ripping it. Great husband to his wife, not me. Incredible father. We're going to hit on that. I'm going to call you a friend. Is that fair?
Yeah, we are friends.
And honestly, you're just cool.
Yeah, you're
Some
cool
people
too.
Are just naturally cool.
You have a cool fire helmet.
I got 3 now, by the way.
Yeah,
The
my
Jags
daughter was
helmets.
disappointed that I don't have something like that, actually. And I didn't take her to a Jags game this year, too, which she was really disappointed.
You can borrow or I'll make you one whenever you want. Dr. Matthew Thompson. There's so many nicknames. What should us normal folk call you?
The illustrious. No.
The illustrious. Just
Matty T. That's, what
like
everybody
Matty
at
T.
the hospital calls me, Matty T. Dr. Matt,
Dr.
Matty,
T.
whatever you want to call me, honestly. I'm an open book.
Dr. Matthew
I'm a
Thompson.
blank canvas.
CEO of Telescope Health, which, again, local organization. We're going to put a big spotlight on that. What are you guys doing? What are you working on?
Yeah.
Just to reiterate, you were one of the early guests.
Yeah.
We were kind of winging it. I think we have it dialed in. Just kidding. We're still winging it. Personal stuff, you can share that. How was Mystery Reader today?
Oh, man. Okay, so I was going to say, this is a huge highlight of the day for me. I love doing this because I love to talk, and I love you, and I love this program. But this is not the highlight of my day. The highlight of my day was being the mystery reader for my daughter's first grade class. I got to give a shout out to her. Hi, Elo. She's going to watch this. Yeah.
I love it.
So I put on all my full get up, put my white coat on, and I went in there and I told him a story about pulling a bug out of a kid's ear. They love that.
Really?
And then I taught him, yeah.
Did it scare him?
I
or
told
they
him a
like-
spooky story. I said, I got a spooky story for you. Dr. Matt's here. And then, I taught him how to wrap up a wrist with an ACE wrap, and I gave them all an ACE wrap to take home. And then I pulled up Telescope Health, and they got to talk to my care navigation manager and my lead care navigator, Cheryl and Sherelle, who are both awesome.
Cheryl and Sherelle. I love shout-outs.
I know,
by the way.
right? Cheryl and Sherelle. It's like a show, honestly. But they're amazing. So, they popped up, and, I said, who likes to FaceTime? And I said, who likes to FaceTime, doctors? And they're like, what? And then I said, well, we talk to people all over the country, and you can talk to a nurse or a doctor, and they loved it. So it was fun.
I think, again, right off the bat, real human being here. You're a doctor, which is not easy, right? What do you guys do? Like a year,
it's
a year or two of school and read like 1 or 2 chapters.
Yeah,
and
I took an online course, actually. A couple YouTube courses. I say that to people sometimes, too, before I see them, like, well, I watched a YouTube video on this, so I feel pretty confident about sewing up your laceration. But
I'm going to compliment you a lot on this, by the way.
Oh, thank you. I need it. I'm
funny,
a narcissist.
Right?
So.
Also,
Not really, but
he's not. Musician, husband, but the father stuff I love. Like, you're just a good dad. And I promise we'll talk about Telescope
I got
Health.
3 girls.
3 girls.
Very difficult to juggle, a business and maintaining a medical licensure and family. And so it's just, life is fun, but if you're doing what you love, then it's great. So
Mystery Reader was the highlight of the week, though.
Yeah, it really was. I mean, when you have 10 screaming kids that are just like looking at you like you're cool, I mean, that's fun. That really builds you up.
I knew this would happen. I just want to talk about fun stuff the whole time.
But you're
Music,
like a
beer.
kid, and you're looking at me like
I am
I'm cool. So
I'm an
almost
41-year-old child. Let's talk about bugs in ears.
Yes.
Now, Telescope Health.
Yes.
I know about it. In like, how do we paint a brief picture to talk about important stuff? It's tough.
Yeah.
Do you want me to read this mission statement, or do you have it memorized?
Of course I have it memorized.
Let's hear it, because some people nail it, and others are like, "Oh crap, I don't know."
So, first of all, we're a healthcare company. Our mission is to use innovative thinking, human connection, and technology to remove barriers to care. So I'm going to break those down.
Yeah.
Okay.
Let's do it.
So really 3 pieces, but the goal is we remove barriers to care. And I think what's neat is when I started the company with Matt Rill, my partner.
Shout out, Matt.
He's
I
an
like
awesome
shout-outs.
guy. Yes, he's a great.
He's also
a great
really
guy. I hope
cool.
he watches this. But he is the CEO of one of the largest Democratic physician-led and run staffing companies for ER doctors in the country and in the Southeast for sure. And so if you've been to a Baptist ER or Lakeland or Southeast Georgia, you've seen one of our doctors. And the
100%.
company was born out, Telescope Health was born out of that company. So what's cool is that, we started with a really deep, profound knowledge of barriers that we see every day as ER physicians, right? And that's just the perfect place to identify, okay, why are people like, what are the psychological, cultural reasons why people are using the ER for their care? And there's so many factors. And so that's how the company started. Then we just hired all these amazing healthcare leaders who joined the team and expanded our knowledge base to be able to provide, solutions for employers and for, health systems. And it's just grown. I mean, it's so much bigger than, as a doctor, you don't understand the business of healthcare at all, to be honest with you. I mean, you understand slightly about how you're supposed to get paid. You realize, okay, if I see more patients, I get paid more. And so I want to see patients. And you don't really understand the downstream effects of how that affects the person you're seeing. I mean, that they're going to get a bill. You know that they may or may not have insurance. You hope, especially as an ER doctor, that you say, follow up with so-and-so. And you may even have a case manager who you say, help them get an appointment with a cardiologist. And they may do that, but are they going to actually go down the right path? Are they going to have the option to? And, you said something earlier today. I'm going to just let it.
Yeah, let's go.
It's not the first time that you and I have talked today. So we did. I know. Yeah, we talked earlier.
This is the first time we've ever met or talked.
Yeah, it is. I know. Yeah. But you said something about, people don't want to engage or choose in their healthcare. We talked about the various friction points. Well, why is that? And I think that the reality is most people do. They want to make the right decisions about their healthcare. And I brought in the analogy of, well, actually, the reality is just like changing the oil in your car. I would love to change the oil in my car. It's way overdue. My car's probably going to explode on the way home today. But
can you relate to that, by the way? Yeah.
Yeah, to do that, I have to drop my car off, probably overnight. I have to get a rental car. I have to arrange for the childcare, make sure there's no other responsibilities, meetings. It just becomes an overload of things where it's like, that's too many friction points. I don't want to deal with that. So it's the same with healthcare. Most people would say, well, yeah, I would love to get my blood work checked and to get on the right track or get my colonoscopy, or maybe not colonoscopy, but
I've had
get
two of those, by the way.
Yeah, but
before 40. Sorry,
people,
too much information.
No, but it's true. But
I had a health scare.
You had a health scare,
Yep.
so it became enough to push you over. But the reality is, most people have too many friction points, and to understand and navigate that, there is a whole psychology, cultural shift, and that's why people don't do it. And so. There are a lot of great companies out there that remove barriers to certain aspects of care. You can now easily get a prescription and see a doctor with thousands of companies in the U.S. via telehealth. So that's why I don't like to say we're a telehealth company, because certainly that is a component of it, but you have to have all the aspects of care. And so it starts with, okay, you're an employer. And I thought it'd be great to focus on the employer aspect of this, because most employers are trying to do the right thing. They want to provide a solution, and they want their workforce to be happy and healthy. And employees are, guess what? People. They're human beings. I know, it's amazing, right? So employers, they.
Let me pause that before you go down that path.
Yeah.
Because I want to hit a couple. You covered a lot there, which is good stuff.
Yeah.
We're gonna hit all of them.
I had too much coffee. That's
okay. No, I love this, man. It's hard to pack this stuff in 48 minutes. That's why I think you and I should have a reoccurring show maybe once a month.
Yes.
The company Telescope Health
started
based out of Jacksonville, which started from a group called ERG, Emergency Resource Group.
Yep.
A massive group of emergency physicians that have worked in Northeast Florida and South Georgia for decades, who have seen and been exposed to every component of healthcare, the real stuff, the not so real stuff. Most physicians, how much training do they give you on the financial component of healthcare? How billing works, how money is made, let's be honest. Did you get that in medical school?
No, not at all.
Zero.
And what's sad is that you don't get a lot of training on population health and what drives health outcomes either. So really, and I'll put another plug in here. We recently created an affiliation partnership with UNF.
We're all UNF grads.
Okay,
dude.
perfect.
We're ride or
Brooks
die
College of
UNF in
Health,
here.
and Dr. Periani, Dr. Zhao, and Dr. Tiemann. that just such an amazing team at the Brooks College of Health, and I love this for many reasons. So I mean, really, at my heart, I love to be a man of the people, but I came up through academics, and there is so much power in data-driven solutions. You have to, and that's what we're taught as physicians. It needs to be evidence-based, and so you got to look at the data. So the things that we do are really data-driven, and we're going to have a lot of publications that come out in partnership with UNF, which I'm really excited about, and we're bringing on a lot of interns from the MHA program into our company too. So just a really cool partnership that I'm excited about.
I might have to go back to that too. Because again, how do we talk about Telescope Health a ton? The employer side, there's so much to cover. You came from in the ER, touching patients, seeing the good, the bad, everything in between. You're kind of an entrepreneur now.
Yeah, I mean, I think I had to jump full in on that.
And a CEO, which is a big responsibility.
We have about 20 full-time employees, and we have hundreds of doctors on our roster, and we're a national company now, and so we have a care navigation team that covers all 50 states, and we have providers that can cover all 50 states. And I think the big change for us was we partnered with Ameriflex, which is one of the largest benefit administrators in the country. And it's funny, their CEO and founder, William Short, is a good friend now, but he's the guy that invented the technology to put FSA, HSA money on a credit card. So if you've ever used an HSA,
do you know what an FSA is?
We use it for daycare.
Okay. Do you know what an HSA is? Some people don't know what those are.
A health savings account.
We have the option here with our
and then a flexible spending account. Some people don't know what that means.
Yeah, right? And so, but it's super common, right? And so what I've learned about solving for the payment of healthcare and employee benefits in the last year has really just exploded my mind, honestly. And it's neat when you combine what seems so practical from my perspective on, okay, you're a person who needs X, Y, and Z for your healthcare. There are significant barriers that I know how to solve from a physician standpoint and from a care navigation standpoint, but there's a whole other side of it on the payment and the employee benefits and how that plays into it. So it's been a really fun year of combining those solutions, and we have so much in store in the future too that we're building, which is great.
When did the company start?
So we started really in 2018, and we've been seeing patients since about this month in 2019. So we're pre-pandemic.
Say something happened in 2020 that kind of upturned the world and maybe helped or didn't help. I think it really put an emphasis on that space. Yeah,
it certainly. We worked with the city of Jacksonville with the COVID test sites, and that was a really interesting learning experience. But it was a distraction from our core, service line, which is really what we're trying to do with the virtual care and care navigation and the analytics components. And so, I'm glad that time period is over. The same problems still exist that existed then. Now we've got a great team to build the solutions. So.
I say this all the time. I'm a self-proclaimed entrepreneur. Mm-hmm. I love the healthcare side. But I realized, like, deep down, I was an entrepreneur.
Yeah.
Like, you see a problem and issues, you want to fix it. And again, I have children that I want to put through school and buy cars for and pay for marriages. So people don't talk about the money side.
Yeah.
I'm okay talking about it. On-demand care, I want to really dive into care navigation before the commercial break. 'Cause that's a differentiator and price transparency. Those are two things that are huge. So on-demand care is everywhere. We won't say other companies, but there's 100, 200, 1,000 on-demand cares. Every direct primary care, great process. Every primary care physician, they all have on-demand care.
Sure.
You like, again, I see something special in Telescope Health watching it. The care navigation. So for, again, I always use Trey and Justin as examples. They're over there. Trey's over there hiding. Explain care navigation, how big of a deal that is.
Yeah.
I get it.
I love it.
Also in like 60 seconds. I'm kidding. We got a couple minutes.
Yeah,
I love stories.
I like simple stories. So Trey, I'm going to point out Trey here. Trey slips off of his skateboard because he's
electric skateboard.
He's shredding the gnar out there, and he shouldn't be. He's past the age of shredding, and he twists his ankle, and he thinks, "Oh gosh, did I break my ankle? Do I need an X-ray?" So here's the spectrum of solutions. You can now get online and you can say, I'm going to WebMD this, and I need an X-ray of my ankle. I can see it here. Google told me. And so I can also look up where I could get an x-ray. I can use Google to do that. And maybe I can even use I can search for the prices of, potentially where to get an x-ray. Okay, so I've decided I need to go get an x-ray. Well, does he really need to get an x-ray? So the next step is to say, you got to talk to somebody to help you find, first of all, where to go to get that x-ray, the difference in cost, look at your benefit plan, look at your insurance to understand, okay,
I'd geek out on this stuff.
what's my copay if I go to the hospital to go do this as opposed to an outpatient imaging center, or through my primary care doctor. There's a big difference in those. So you need somebody to help guide you that. But then you also need to understand, do I really need it? Because if you saw a doctor, they could say, well, hey, we're going to follow the Ottawa ankle rules. And if there's doctors geeking out there listening to this, they'll understand that. You can put weight on it. You really don't need an x-ray right now. You need to ice it, elevate it, compress it, and tomorrow we'll see.
Rest,
we'll
ice,
rice
compression,
it.
elevation.
We'll rice it, and then tomorrow we'll see you again, and you feel better. So you took some ibuprofen, and you didn't need an x-ray, so you avoided that cost altogether. So it's a spectrum of solutions that you need, and any one of those is beneficial, but it's not the complete package. So what we provide really is that full spectrum. We provide the on-demand providers. We provide it's kind of like concierge care where you have a guide, somebody's helping you say, okay, here's the places where you could go. That's a nursing-led team. And then we have the tools that you can use and that we use to show the price transparency or the difference in cost based on whether you have insurance or don't.
So there's so much overlaps there. And again, we work and live in this space, and I'm trying to give it for whoever the audience is. Let's use that same example. Depending on who it is, a lot of people say, oh man, I don't know where to go. I'm walking straight into that ER.
Yeah.
Which when you talk to the care navigators, the concierge care, hold up. Because the second you walk in that ER, you might as well multiply your bills by 5.
Yeah. And you know why they do that?
And then come to our x-ray facility plus 5. I'd love to talk about precision imaging. If you have a connect there, I want to get them on the show.
Yeah.
Versus talking to your team that says, hold up, Trey. You were shredding the gnar. You rolled your ankle. Let's look through this. Ouch. Instead of spending between $5,000 and $7,000 for all of this, let's wait a couple days, do these things. It may be uncomfortable. We can call you in a script. And then we're going to send you to, I like free shout outs to Precision Imaging. And that cost for an x-ray may be $300 versus $850 or $1,000, which hits your insurance on the back end, and your employee at the end of the year is like, oh my gosh, Trey was shredding the gnar again. He went to the ER, and our entire insurance rate goes up.
Yeah, absolutely.
Back to the care navigation, because I want to talk about how do you decrease those claims on the back end, and it boils down to the end consumer. So care navigation, that's one example. You have many of them. I love this. What do the care navigators look like? Clinical experience? Is it some Joe Schmo? Like, do you find a guy like Eric Ross at the gas station ripping heaters? Hey, man, give some advice.
We really, the bottom of the barrel digging for us. Our team is amazing. So we have, it's a nurse practitioner-led team, and Janice is our clinical operations director, and she has trained countless physicians and advanced practitioners over the last 15, 20 years. And she's amazing. And then we have our care navigation manager is a former nurse manager for Baptist Health and also a case manager. And so pulling in all those skills. And then our care navigation team is built on anywhere from nursing, certified medical technician to honestly one of my OG, Cheryl, I hope you watch this too, Cheryl. She ran a primary care practice in the front office before she joined us, and she was our first care navigator back in 2018, and she just understands the process.
They know the game.
They know the game, and so a lot of this is shared decision-making, and the reason why people go to the ER is because, easy, I'm hurt, I need to go to the ER. Don't have to think any more about it other than that. It's just like, that's why is AARP so successful? It's a phone number. You just call it. You have an issue, you just call it. You don't have to think anymore. So
start there.
Yeah, so that's what we've done. We have a hotline. You can immediately talk to a person, and that's where the human connection comes into play. Is sometimes you don't want to make the decision, you need shared decision making. So the only decision you need to make is to call. And so, our employers, we have apps, and we have online web solutions, and I love those. Some people don't want to talk to people, but at the end of the day, as an employer, you want to know, hey, they can just call this number and they're going to start their healthcare journey and get taken care of. And so that's where we start. You got to remove the friction points.
Friction points, talk about that too, right? How do you eliminate friction points? Price transparency, that again, if you geek out in our world, that is a huge deal. CAA is part of that. That's another conversation. How much time we got left, Justin? 6 minutes. I'm the only guy that asked because this is live. Here I am winking again.
Yeah.
Price transparency. Another example is right now, I got a bellyache. I want to figure out how to fix this bellyache right now. But if I go here, it's X amount of dollars. If I go there, it's X amount of dollars. If I have this insurance card, it's Y amount. Like, talk about the importance of that and what you guys are doing in that space with Telescope specifically.
Yeah. We have a great partnership that's with a company called Handle Health, and they provide the back-end databases and claims data so that we can understand based on your insurance, and it's fully integrated into our software. So, a patient or anybody who's using our platform or our care navigators can say, okay, this is your insurance, and based on that, this is the cost for the services that you're looking to get. And so that transparency right off the bat is huge. First of all, that's a requirement based on the Consolidated Appropriations Act. It's a recent requirement. And if you go on LinkedIn or online, you will probably eventually, if you type in, something related to healthcare or employer benefits, you will see ads now from legal entities or legal groups or attorneys saying class action lawsuit against Lockheed Martin or whoever. They're out there.
CVS,
exactly.
Heinz Ketchup,
and
Ford.
It's all, are you an employee who spent too much on your health care? Your employer was responsible for providing you options and showing you where you could get cheaper care, or different options of care. And so that is the Consolidated Appropriations Act. So our solution fulfills that requirement, which is key. It's funny because you can check off the box and say, hey, listen, I gave him a price shopping tool. That's essentially what you could call it, a price shopping tool. But again, go back to that ankle, story. You may think you need something. That doesn't mean you necessarily need it. And also, you may find the cheapest option, but you got to drive further, or it's a low quality option. We don't want to send people to the cheapest healthcare because the downstream effect of that isn't the best care, and it's actually more expensive. So.
How do you combine the two? So again, before every episode, believe it or not, I prep for these sometimes, and how do you get one sentence to explain something? Because when I talk about high deductible health plans, I got some bullet points. We might not hit that. So CAA, the Consolidated Appropriations Act, it came out in 2021, but now it's like, hey, if you don't follow these rules, we're going to give you a slap on the wrist, but then you're going to be in trouble. One sentence, this is the quickest one I could find. Established protections for consumers related to surprise billing and transparency in healthcare.
Yeah.
So think about that. Anyone who's gone and seen anything in healthcare, it just happened to me not that long ago. Something came up. Thought I had it covered. I'm like, I want to pay everything cash up front. 3 months later, you owe us $3,000.
Yeah.
What? Again, this is someone who lives and breathes in the system. And then transparency, we've talked about this. It's coming, it's happening, but it is a slow moving.
Yeah, it is. And the ramifications on employers is still to be seen, but it's out there. The act is out there, so they're going to be held accountable. And you can see in class action lawsuits they already are. So,
I think my least favorite part of this show is how quick time goes.
Yeah,
which I knew would happen.
We're having so much fun.
I am.
Yeah, still not the best part of my day. I just want to say
I know it was mystery reader and when I called you my husband.
Yeah, that was a good.
I did not. Part. I said you're a good husband. Dr. Matthew Thompson. So many nicknames. CEO of Telescope Health.
Yes.
Flew by. Second half, we'll do a little fun, then more serious. That's what the health just happened. All right, welcome back to the second half of What the Health Just Happened. If you missed the first half, good news is it'll be available on your favorite podcast platform, or you're hearing this on the podcast platform. It's hard to talk fast.
Yeah, podcast platform. Podcast
platform. Go ahead, Justin. Let it rip.
Podcast platform.
That wasn't that fast. Dr. Matthew Thompson, CEO of Telescope Health. Incredible dude. Listen to the first half if you missed it. We talked a lot about the business, on-demand care, which exists everywhere, the care navigation that you guys have, which is special, unique, price transparency, which is, I believe, the direction that healthcare is going. We talked about oil changes comparing it to healthcare.
Yeah.
We talked about mystery reader.
Yeah. We did.
We talked about bugs in ears. No, I'm kidding. There was a lot of serious stuff again.
Yeah.
If you're hearing this on the radio in the second half, catch the rest of it on the podcast. Healthy or not healthy?
Okay, I'm
Ready?
Yeah.
CEUs, continuing education units.
Oh, it depends on the context.
They're garbage.
Yeah.
What do most people do? Click, click, click.
Yeah, it's
pass,
true.
pass, pass.
Well, that's why I say it depends on the context. So, I'm the medical director for AmeriPro, which is a EMS company based here in Jacksonville.
Oh, yeah.
And the EMTs, medics, just the coolest people. And so I'm actually really proud of this. We just actually set up a rotation in the Baptist Beaches ICU with Dr. Polito, who's an awesome guy too, is an intensivist and physician. And they're going to go there for 4 hours. They're going to get, their continuing education units. And they're going to learn a ton. I mean, it's going to be awesome. There's going to be hands-on learning. But I agree with you. There's a lot of, requirements out there for licensure where you just click, click, click. So I think we need to change the approach for education.
So healthy, not healthy. That was a good, by the way, now I'm suddenly interested. I kind of want to re-up my medic license. I keep my nursing license up, but okay. Healthy or not healthy, hype music.
Oh, man. I'm so glad you brought this up. This is the best. Okay, so I got a new hype song, and
Tell us.
Okay, we ring the bell at Telescope, and we have like a success, whether it's a contract success or when we have like a patient story success, and so we got a hype song, and
you can ring my bell.
no,
not a hype song.
Can
sorry.
you put this so it's Start a Riot? It's
that's good.
Which if you've ever been to an Iceman game, between second and third, they turn off all the lights and.
That's a jam.
I mean, and so we just pump that up in the office and then, ring the bell.
Okay, before we switch to the next healthy or not healthy, do you have outside of work, like what's a song I'm like, I got to put this on in the car and I'm ready.
I mean, that is my hype song
right now.
Yeah. And I feel like we need to just play that song at some point in time here. But,
okay. You're a creative person.
Yeah.
You and I have a lot of similarities, I think, too, right? You try to balance all this stuff. You want to be successful. You want to do what's best for everyone. Healthy or not healthy, quiet time to create.
Yeah, you got it. So I actually implemented some changes in my morning routine where and my wife, shout out to Lacey Beth.
Lacey!
Boss lady.
Which camera?
She said, you got to just turn off your phone, or put on the focus. And it's really the do not disturb. And I really held on to that now because you got to have some time to just turn off the noise. And I use that to... It just depends. Sometimes reflect, sometimes just look through my list and, think of ideas, think of things like what's high level really important right now. Look at family requirements. It's just, all sorts of things. But
do you ever just stare at your hands and be like,
yes,
I want nothing.
I am real. Yes,
Trey's scratching his face over there.
Yeah, no.
We'll get back to business. These are so...
You got to empty your brain is the bottom line.
I got two more random ones here.
Okay.
Healthy or not healthy, gas station hot dogs and taquitos.
Oh, you've used this one before.
Did I really?
Yes.
Because I just stopped at the gas station on the way here and I saw them
okay.
15, 20 years ago. Listen, I would have eaten that.
I'm a big hot dog fan. I'll just say this right now. I love a good hot dog. And I'll do a shout out because Bearded Pig, they have mini kid hot dogs, so and I just love them. And my kids, we get them for my kids, and then I eat them before they eat them. So.
Oh, that's good. Okay, last one here.
Yeah.
Healthy or not healthy? Is that an Aura ring?
It is an Aura ring.
I used to have one of those. I've lost two of them.
This was a Christmas present from Lacey, and I'm a data nerd. And I'll say one story about the Aura ring. 2 days ago, I got a notification, and our kids have been sick. You mentioned this too. Your family recently sick. Last week, got crushed too. So my 2-year-old Winnie, she was sleeping in bed with Lacey. I was on the couch, and the next day, ding, Aura ring's like, you got your best night's sleep ever. And so I told my wife that. I was like, hey, babe, just want you to know, thank you for letting me sleep on the couch. No interruptions from the kids. Because normally we got, babe, we have a 1-year-old, we got, we have a 6-year-old, so we're in the trenches. So I got my best night's sleep. Thanks, Aura.
I like, and I promise we'll go back to really heavy emphasis on Telescope again. So the Aura ring, data matters, right?
Yeah.
Taking care of yourself, diet, exercise.
That's
we
where
talked
we should
earlier
start with Telescope. Yeah.
So we'll get to, I promise. Up here, this brain works, believe it or not. So the Aura ring tracks all this data information. And one line I use all the time, we'll do two things here, data and who's responsible. At the end of the day, I tell everyone, who is most responsible for your healthcare costs?
Yeah.
It's you.
Yeah.
And what's the number one way, in my opinion, to avoid rising healthcare costs? Anyone? Is to avoid needing it as much as possible.
Yeah, absolutely.
And that's hard to talk about. Some people are like,
Yeah.
oh, that's uncomfortable, which goes back to diet and exercise. But again, I am a huge Oura Ring fan. My wife won't let me buy a third because I've
Yeah.
lost 2 so far, and they're not
Yeah.
cheap. So
Well-
data matters. Take care of yourself. We can talk about that.
Gosh, there's 2 ways we could go with that. I mean, so much culture. I mean, if you are, and I'll just say this: if you're a white millennial, then being healthy, subscribing to podcasts about your health, obsessing in an OCD manner about the data around your health, that is part of the culture, right? And
Right now it is.
Right now
Podcasts,
it is, right?
ice baths, data.
Yes,
Yeah.
exactly. So it's, and I'm sure that you and I are probably bombarded by the same advertising, cultural phenomenons, changes, but that is a small section of the actual population culture as a whole, right? And so if we're going to put effort into making health equity a reality, which is everybody should have the same experience in healthcare, the same opportunities. There are social determinants of health that affect, our ability versus others. And so you have to look at immigrants. I'm going to take Jacksonville in particular, right? There is a cultural wealth in Jacksonville that is untapped. And there are populations of people in the Black community, Hispanic community, in the immigrant population that are doing amazing things. And what's sad is that other sections of the culture don't see that, right? And so I think health and health equity has to be on the forefront of this, because a lot of the issues we see in healthcare are areas that we don't typically see in certain parts of our society. And so, but it all starts with data. I think coming back to data. And so analytics, data analytics, garbage in, garbage out. If you get bad data in, it's just like this ring. If it's not recording, or how do you interpret it? What do you make out of it? And what do you do with it? Like you've got all these things on this, on your app that are showing you, here's your heart rate variability. Well, what does that even mean for you as a person? What do I do with that? So
What's HRV mean?
Yeah, exactly. So we've taken a lot of the data with population health, bringing this back to the different sections of our local society and culture, and said, okay, we need to narrow down the areas that we can implement easy, low-hanging fruit changes. And some of those are, okay, let's identify all the people with high blood pressure or diabetes who have no transportation in the city. Because right there, you're going to identify people who need very simple access to care, but they're not getting it because of a very simple reason. And so you can provide, simple changes for those people, as easy as let me call or outreach to those people and say, hey, I recognize you have diabetes. You haven't seen a doctor in 24 months. We looked at, your health records, and how can we help you? And then it starts there.
I want to emphasize too, though, that population in any city. This is not. We live in Jacksonville.
Oh, yeah.
We love it here in
Yeah,
Northeast
absolutely.
Florida. This is what we're familiar with. But this, name a city in the United States.
Mm-hmm.
Rural areas are different conversation for a different day. But those patients with these barriers, and again, health equity is a big term right now, and it matters. Social determinants of health, huge term right now. But the cost of that care and lack of access to care, and frequent flyers coming into the ER, what could be dealt with elsewhere, that's part of what increases the cost of health care for people that are like, why the hell am I spending $20,000 a year on a premium?
Yeah.
It all matters.
You can't say that, guys.
I can say hell, right?
Oh, I don't know.
Oh, yeah. You
Okay.
can say
All
hell.
right.
Hell's good.
Okay.
Oh, geez.
Yeah. All right.
I can't say
I was
bleep,
warned. I was
bleep,
forewarned.
bleep. No. But again, do you
you're
agree
right.
with what I'm saying? If we don't
100%,
collectively agree with it, again, take care of yourself, do what you can.
Yeah.
But as a community, we love this community. How can we give back? And
Yeah.
data, back to Telescope Health. Let's rein it back in, because I'll get on a tangent in this world.
Yeah.
What data are you collecting?
Oh,
How does
man.
it help? Why does it matter?
So much data. We just
Is
have
it
a really
data
smart
or data? I love that question.
It depends if you're a Star Trek fan or not, I guess. But so we have a really great team of people with a deep analytics background, which I do not have. So we ingest, for population, we ingest publicly available data that's just hard to access, and then we put that into our platform to understand it and analyze it. So I talked about transportation. That's certainly one area, but looking at the number of medications that people are on, for example. So we've done programs where we worked with insurance companies and said, give us the patients that you haven't seen or have not seen a primary care doctor in 12 to 24 months. And then we'll go narrow down those to look at the ones that are on 5 or more medications, who have 3 or more medical conditions. And then we outreach those people and we go see them and we get them back on the track. And the things that you discover when you identify that population is really crazy. Patients who, hey, for the last 3 weeks, I haven't been able to walk as well. Well, that's because they had a stroke, legitimately. They did not seek any care.
CHF and they're swollen and because they haven't taken their water pill, Lasix in 3 weeks.
Absolutely. Or I've been feeling lightheaded. Well, I'm a diabetic and their blood sugar should be 100 and it's 800, just crazy stuff. And so that's the reality of what's happening out there. And then on the employer side, it's the same thing, but it's, we're able to take in the claims data. So, employers have insurance coverage for their employees. They'll give us access to that data and we'll be able to say, okay, wow, you have 300 employees. Here's the top 5 spenders. Here's all the people that went to the ER. Here's the people who haven't been to a primary care doctor. Here's all the people with diabetes. Now we can create a specific plan for those employees to make sure that we're tackling those people first.
That's our world. 212 Benefits. Thanks for sponsoring the show. That's my business, by the way, with Joey and Adrian Jansen, amongst many other great people. We work in employee benefits, which is complicated, expensive, and it's tough.
It is complicated.
You live in there now, too. Yeah. So you take this, most people, you basically fall into 3 buckets, right?
Yeah.
You have insurance through your company.
Yep.
You're uninsured, or you go to the open market.
Yeah.
That information matters for a business to say, hey, look, here are your biggest spenders. Here's where you can save costs. Here's where there's poor medication decisions. Let's go to partnerships.
Yeah.
You talk about want to give a shout out there. So you work in the ACO space, value-based care, a recent partnership with Ameriflex. I like giving free shout outs to anyone.
Yeah.
You guys got to pay me for this, by the way.
Yeah.
Just kidding.
We have some really great partners. You can't do it alone. And one of our most recent partnership is with UF Health, their population health department, statewide, and super collaborative team. And we had previously worked with Flagler Health, and then UF gave us this opportunity to provide analytics and care navigation to population in St. Augustine, and we're going to expand that statewide. So that's a great partnership, and that's using solely the analytics and care navigation side. And it's oftentimes there's a lot of doctors that have open spots and want to see patients, and it's organizing and identifying the people who need it the most and enabling them to see the providers, and enabling the providers to say, hey, you're a primary care doctor, you have 300 patients under your care. You've seen 200 of those and you've done a really great job, and 100 of them, they're under your care, but you just can't reach them. Well, it's not your fault. You're busy. You're working from 7A to 7P. You're inundated with charts. So let us take those patients. Let us outreach those patients, identify the reasons why they're not getting care, and help get them back to you. So that's, a big part of our programs. Within the health system, what's crazy is that there's so much opportunity to provide care and solutions in the health systems. And just about every health system right now, if you ask them, what's my main problem right now as a health system? If you ask administration, they'll say it's boarding. What
is boarding, by the way?
Yeah, so it's patients who you want to be in the hospital for 3 days and they're there for 7 days. And there are too many people, not enough hospital beds, not enough physicians. That is just the problem in U.S. healthcare.
Reality.
It's reality. And so what they want is to find ways to get those people home where they should be faster, and to keep them out of long-term care facilities, out of skilled nursing facilities, and just get them where they need to be, home. And so we've got a lot of really cool programs that we've put out with Baptist Health, for example, where we identify people who are leaving the hospital, and we'll do what's called transitional care. We'll outreach them, we'll help them, because they often will have a primary care doctor. That's not the issue. It's just, hey, I left the hospital. My primary care doctor didn't even know I was at the hospital, and I got to make an appointment. I'm very vulnerable right now. How am I going to see them? Well, first appointment's 10 days away. Well, that's the crunch time.
I need to see someone.
You
in
got to
like
see
48
somebody.
hours.
Yeah, exactly.
72 is too long.
Exactly.
I lived in that world.
You
Yeah.
did live in that world. And so we outreach and then we facilitate them to be seen, answer their questions, and make sure we keep them out of the hospital. So those kind of things need to happen. And every section of the market, whether you're employer or health system or, an organization like an ACO, has their own unique problems. But
I feel bad I cut you off to describe boarding. You're listing a couple things that were issues and concerns. So boarding was one. What are some other problems that...
the capacity is just a huge issue. And Becker's put out a recent article highlighting the capacity issue. We will see, the top 2024 problems, and one of those is in 10 years, we could have a shortage of up to 130,000 physicians. So,
and what other clinicians?
Oh, I mean,
registered nurses.
Yeah, nursing.
They're looking
huge
at
problem.
600K.
Yeah.
Here's Trey.
Does that have anything to do with the cost to get into that particular field?
It's certainly multifactorial, and cost is a huge barrier. I mean, the price to go through medical school and residency training it's not cheap. But I think healthcare in general, the pandemic caused a lot of changes in people's perspective on, do I want to go into healthcare or not, and what do I want to do in healthcare? And it's generational changes too. Gen X and millennials have a very different idea and mindset on, hey, work-life balance, and you really sacrifice a lot to go through the training necessary to become a physician. And a lot of people now are just not willing to do that. So we have to re-energize the next generation to say, you can make a difference in healthcare. So getting back down to that patient story of how, a physician can really make a change in somebody's life. I think we need to get back to that narrative because we've taken away the luster of, and a lot of doctors will call it the golden age of healthcare. And it was 30 years ago. There was a respect and desire to be a physician, and that's changing a lot. It's more transactional in nature.
It's because of TikTok and Instagram.
Yeah.
I'm kidding. I just sound like a middle-aged.
The TikTokers, and what are they doing, those kids? So there's a lot of reasons, but the bottom line is there's a capacity problem and there's a shortage, and so we have to find ways to outreach people. And I'll say this too. Your care shouldn't start with a physician. A physician should oversee your care, but your ability to have simple things like understanding baseline blood work, understanding what conditions you have, looking at your health, mental health, holistic approach to the barriers you have to care should start with other people within healthcare, right?
I know a company that can help with that.
Yeah.
Oh, Telescope.
Yeah, and that doesn't degrade the value of a physician.
Correct.
It strengthens it because we have to accept the reality. There's just not enough physicians. And if you wait to go get your questions answered by your doctor, you will wait for a very long time. And guess what? You'll just give up. And that's what people do. It's why I haven't gotten my oil changed.
Back to the oil change.
Back to that one. Yeah.
Oh, I knew the oil changes come up again. So if healthcare doesn't work out for us, and I think it is, there are people like you and me and others that you meet in this industry that really, let's call it what it is. Like I have to pay my bills. I have to make a living, right? I have to put food on the table, but I think want to make real change.
Yeah.
And in this space, it is very, very, very difficult because you're up against, not knocking any local large hospital systems, but they're big.
Yeah.
They have heavy bats and they do certain things. And large insurance companies, by the way, I work with all of these people, it's not easy to make change.
Yeah.
But it's happening because of people like you and people like Telescope.
Yeah.
But if this fails,
I hope so.
we had talked about this earlier, we're going to open a business that will change your oil, wash your car, you get your hair cut, and you can see your primary care physician at the same time.
Dry cleaning
like a
too,
great
maybe the
service.
post office. Yeah.
In the post
monthly?
office.
Yeah, that and like a dentist that changes
All of
the
it.
photos at the same
What are
time.
all the
Like,
things that you have to take a day out? It's like, you know what? This is my one personal day. I'm going to check all these boxes.
Yeah, absolutely.
How much time we got left? Okay. Again, it's so hard to cover all this stuff. I think you and I could talk about so many different topics forever. A couple minutes here. What are you most excited for looking forward for Telescope specifically? I mean, we could talk about mystery readers and guitar sessions and going to a brewery and hanging out, but let's stick on healthcare here.
Well, two things. I think we're very fortunate with the partnership we have in the employer space, and I guess I love Jacksonville. I moved here almost a decade ago, and the people here are just the most collaborative, humble, wonderful people. And in the business, I mean, getting out of really being primarily a clinician, and now, like you said, I'm a businessman and entrepreneur, and people want to work together. And so what I'm most excited about is what we're doing in this city, to be honest with you. And we are a national company. We have national partnerships, and thankfully all those solutions apply to Jacksonville. And so what I love to see is growth of those partnerships and collaboration. So, hopefully that's with the city, and hopefully that's with more nonprofit organizations. I feel like we have put a lot of time and effort into working with some really great organizations. We Care Jax is one of them, which connects people with specialty care. And then Rethreaded is another that we work with, which I just love Kristen and that organization. And so there are people doing really innovative, amazing things here. And on the employer side, I feel like there's so much opportunity through, there's a lot of startup companies, a lot of self-funded companies here, and employers that want their employees to be healthy. And so we have spent a considerable amount of time building those solutions. So I just love to see it take off locally where I live.
Any more shout outs?
Just to you,
Holla!
Yeah.
I don't know. I can't believe I just did that. Can you edit that out? I'm kidding. We don't edit anything
you did
out.
That. You did that. I think we should put it on repeat, honestly. Yeah,
no,
just make him own it.
He does that. He puts things on loop. He will. Look, I told you it's fun. Maybe it's awkward, maybe it's not, but I appreciate you, man. I respect you. I think you and I have a lot of similarities, both personal and professional, and I think we want what's best for as many people as possible, and just lead by example. So
I'll say you can put my information up, and I love to collaborate, and so I've met a lot of really great people through the Jax Chamber, and I think Small Business Leader of the Year. I'm really proud of you and impressed with you, and I love those partnerships. So I would say my final plug would be for people in the community here. Reach out to me, please. I'd love to collaborate and work together.
If I can help get in touch, get you in touch with anyone or vice versa. But time runs out. Here we are.
Yeah.
Dr. Matthew Thompson, Dr. Matty T. Just a good dude, man. I told you guys he's awesome. CEO of Telescope
I wore my
Health.
nicest shirt for you today.
Appreciate you joining us. That's What the Health just happened.
Hustling.